So, Carly, you're here today, about 12 days after your surgery, right?
Yes.
And we actually did both feet at the same time, which is pretty rare because you were driving from Jacksonville to Central Florida, which is how long is the drive?
3 hours.
3 hours. So we didn't want to do one foot and then the other foot because, I mean, it would be too much driving, right?
Yes.
Plus, you were in so much pain when I first met you. How many doctors did you see before me?
Oh my gosh. Probably 6.
6.
Mhm.
And you had pretty severe plantar fasciitis, right?
Yes, for 3 years.
3 years.
Mhm.
And I remember, like, I couldn't even touch, especially one of your feet because the pain was so severe.
Oh yes. It was very bad.
Very bad. And
Mhm.
how is the pain now, 2 weeks later?
To be honest, after the surgery, after 2 weeks, I feel so much better, and actually I feel I can walk finally, normally.
Mm-hmm.
Before it was terrible. I couldn't step on the floor or do
Good.
anything.
And I actually, because today we took the stitches out,
Mhm.
so I want you to start wearing like normal shoes with
Mhm.
inserts, right?
Mhm.
No barefoot walking yet. In a
Mhm.
couple of months you can, but
Mhm.
right now, like, kind of let the surgery settle in, let it
Okay.
work, right?
Mhm.
The good news is that if you're that much better in
Mhm.
such a short time, we know it pretty much worked.
Uh-huh.
The biggest disadvantage of your situation is that you had it for a long time. So if I have a patient who has it for 6 months, then we know within 6 weeks they're like 100% better.
Mhm.
But because you had it for a while, one of the things I want you to look for is maybe the shoes that you have not worn a lot before the surgery because of the type of walking you were doing. Like if you were compensating and walking on the outside of the foot, I don't want you wearing the same type of shoes because it's going to shift you to the outside and you're not going to have a normal gait, right? So if you have almost brand new shoes, don't throw them away. But if it's a very old shoe, very worn out shoe, you might consider getting rid of it.
Okay.
Okay?
Awesome.
And give it time to heal.
Okay.
I mean, I know we're 12 days later, you're very happy, your husband is very happy, your mom is very happy, right, Mom? But overall, it's been only less than 2 weeks, right? So give your body time to heal, right? So just because you had results almost right away because the pain was so severe, it's going to take you more than 2 weeks to heal something that you've had there for 3 years, right? And remember how when you first came to me, you even said that the diagnosis of tarsal tunnel was mentioned, and I know that your husband was very concerned about it, and we chose not to do that surgery because we knew that plantar fasciitis was the number one reason why you had so much pain. But you still have to give it time to heal. Just think about it. You had so much inflammation that you were already having secondary changes happening just because of that one problem that you had. So let it heal, okay?
Okay.
So, I mean, overall, I'm very happy. And what I'm going to do is I'm going to let you go. Usually, I do see patients in about 4 to 6 weeks, but I know it's a very, very long drive. So, what I'll do is I'll make you a deal. I'm going to give you an appointment, but if you are doing very well, then you don't need to spend 6 hours in the car driving, okay?
Okay.
You can easily just call and say, I'm doing fine, everything is good. And we'll go from there, okay?
Mhm.
Okay.